Hello, my name is Terica Kelly, and today I will be performing a Foley catheterization on a female. It is November the 13th, 2017, and it is approximately 5 o'clock. So, I will begin by performing hand hygiene, checking my physician's orders, and going into my patient's room, performing hand hygiene again, and introducing myself while checking my two patient identifiers. Then I will see if the client understands why they are getting a catheterization. If not, I will explain that to them. I will also assess the client's catheter size along with any allergies they may have, like to latex. The client's condition, I will also assess the last time the client voided, the color, amount, and odor of the void. I'll also assess for any abdominal distension or tenderness. Then I will begin to perform pericare. I have raised my client to a comfortable working height. I've provided privacy for my patient, and I have him or her set up in a comfortable position so that I can do this procedure. So now I'm going to don on clean gloves. Now all I have for this is just some warm water and some mild soap. And I'm going to use separate cloths for each side, and I'm just going to perform care side, and then down the middle. Lastly, down the middle. Alrighty, making sure to go front to back. I will then remove these gloves, perform hand hygiene, and let the client know that I'm about to start the catheterization. I will begin by setting up my sterile field. Carefully. Now I'm going to place this under my client, shiny side down. Alright, I'm going to don on my sterile gloving. Now I can fix myself. Alrighty, now I'm just gonna start by setting up my sterile field. And preparing to administer the Foley. I'm going to take out the swabs to perform another pericare. I'm sorry. I'm going to lubricate the catheter. Being careful to make sure that the catheter does not lose its sterility. This is better. Okay. I'm then going to attach the syringe to the bowl. Now, I'm going to perform the final pericare before insertion, going down each side of the labias and then down the middle. making sure not to move this hand that's touching the client anymore because it's technically not sterile. So now I'm going to take the catheter and carefully insert it into the urethra, telling the client when I'm about to insert it and asking them to take a deep breath. And once I get it in, I'm going to keep going until I see urine return. And once I do, I'm going to insert it about 1 or 2 more inches. And then I'm going to blow up the balloon that is inside the client. And I'm going to pull back, making sure that I feel resistance. And then I plan to tape or secure this tubing to the client's thigh, and then I'm going to make sure that the catheter bag is attached to an immovable part of the bed. And after this, I will make sure that my client is comfortable. I am going to go ahead and clean up my sterile field. Perform hand hygiene again, and then I'm going to put the client in a comfortable position, lowering the bed, and making sure that she has her call light or any of her personal items that she might need. And I would assess how much urine came out when I inserted the Foley catheter, and then I would go document that in this procedure. Thank you.